Hey, I'm Dr. Dorsa from Performance Chiropractic in Denver, Colorado. Today I want to talk about disc herniations and some of my favorite therapeutic exercises to get you feeling a little bit better, a little bit faster. So I have personal history with disc injuries. I've had 2 in my neck from snowboarding and 2 in my low back from standing acrobatics. So I'm going to give you some insight based off things that I've experienced as well as things that come into my office every day, combined with scientific literature. Discs are the guys that sit in between the vertebrae. They basically help to limit and support any motion. However, they're not really designed for a lot of motion. When we get too much activity going on in the low back, that's typically when we get injuries here. So the mechanism of injury is flexion, rotation, and picking something up or exerting yourself. I'll hear picking up a sock or coughing. Not necessarily the exact reason. That's typically just the straw that broke the camel's back. Sometimes we'll just feel these injuries localized, so just in the low back, but sometimes we can get full-on herniations where that disc comes out and irritates that nerve, sending stuff going down the legs. Here's an MRI image cut of my lumbar spine. From an imaging standpoint, it's really not that bad. However, at the time I was having sharp shooting pain down my legs, numbness and tingling, all that fun stuff. So I typically don't recommend getting imaging right off the bat. For one, it's really expensive. And then there's a lot of orthopedic testing that we can do in office to dial in that diagnosis and get you started with therapy and rehab. If, however, it does go beyond 3-4 weeks and you're still having hard neurologic signs, that's when we'll typically go in and get that imaging just to make sure that there's nothing crazier going on. All right, last concept, and then we're gonna get into some movement therapy. So with our lumbar spine, we have this really awesome curve. We call it a lordosis, which sets us up into extension. What happens is when we sit too much, whether it's with work, driving, or sitting on the couch watching TV, we create this hunched over flexion position. What that does is it puts more pressure into the front of the disc, allowing everything to kick out into the back, hit on that nerve, and recreate our symptoms. So our main focus is gonna be to create more extension. All right, this is our end goal. If this looks like it's too much, we're gonna start with some regressions. First one being just laying on the belly for about 2 to 3 minutes, taking deep breaths. If you're feeling pretty good about that, we'll come up onto the elbows. Same thing, making sure the low back is relaxed. Next step is to come up onto the hands. If this is where you're at, that's fine. If you can extend the elbows completely, that's even better. We're gonna be doing reps of this. The most common mistake is that we take the hips off the ground and we end up doing kind of a push-up. We wanna make sure that we have the pelvis onto the floor and we're doing reps with that. The reps are important because that's gonna pump the good stuff in, the bad stuff out. We don't have much vasculature going through the vertebrae, so that's gonna help speed up the healing process. Keep in mind, these are general recommendations. Everybody and every injury is a little bit different, so it's not a bad idea to get it checked out by a professional to make sure you're moving in the right direction with your care. Remember, movement is medicine. All of our research shows that exercise is the fastest route to recovery. If you like the video, make sure to subscribe, like, and comment. I just started making these videos and plan on updating weekly.